If you're over 50 and you're dealing with chronic back pain, there's a good chance the hidden culprit could actually be degenerative scoliosis. You see, most people think that scoliosis is a teenage problem, but the reality is we see more scoliosis in adults, especially older adults, than we do in teenagers. And if it's degenerative scoliosis, the longer you wait to address it, the worse it'll get. Hi, I'm Dr. Chris Gubbels, the lead clinician at ScoliCare Denver, and it's literally almost a weekly basis where we get someone that comes into our office or calls our office that has degenerative scoliosis. And most of the time, these are people that had no idea they had scoliosis, but they started to develop more severe and chronic back pain as an older adult. And they end up going to see some kind of healthcare provider. They end up getting an x-ray and they get told they have scoliosis, and they didn't even know they had scoliosis. The other thing we frequently see is we'll have someone that will give us a call and they knew they had scoliosis when they were younger, but it was small and it wasn't really a concern. Or maybe they did some treatment like a brace when they were younger, but they were told when they're done growing, it's not really a concern and it won't get worse. But frequently in their late 30s or early 40s, they start to notice back pain and possibly noticing their posture starting to change and notice that their curve tends to get worse. Then when they come in to see us or we get a new x-ray, they find out or realize their curve has actually gotten more severe than it was when they were younger. I'll tell you a great example, our patient Bert. Now, Bert is in his 60s and he's a very active adult, but he started developing chronic and severe back pain to the point it was literally affecting everything in his life. Bending over, exercising was becoming very challenging to do. Going for walks was becoming very hard to do. He was an avid cyclist and he got to the point where he couldn't do any cycling at all. Now, he tried a lot of different treatments. He did many bouts of physical therapy. He saw a chiropractor. He had multiple epidural injections. And in fact, he had 2 different spinal surgeries. He had a laminectomy and he also had a discectomy. None of these things were really resolving it, and no one even mentioned, non-surgical treatment options for his scoliosis. In fact, his neurosurgeon told him she did not want to do surgery because she thought it would cause more problems down the road. And it wasn't until he consulted a chiropractor that actually knows me and knows the kind of work we do did he get referred for specific non-surgical treatment options. And when he came in, we gave him a custom brace and scoliosis-specific physical therapy, and we've greatly reduced his back pain, and now he can pretty much do all of his normal activities, including going cycling again. There's a few things you should absolutely need to know. Degenerative scoliosis is actually very common. If we look at teenagers, only about 3% of teenagers get diagnosed with scoliosis. Once we hit 40, it's about 9% of 40-year-olds. And we hit 60, it's about 38% of adults get diagnosed with scoliosis. And when you look at people that are up 70, 80, 90, it's anywhere from 50 up to 68% of adults. So this is a very common problem, and it's more likely to develop the older you get. So if you're an adult and you're dealing with pain from scoliosis, be sure to click on the link below and download our free ebook called Scoliosis Knows No Age Limit. Another point you want to realize is scoliosis or degenerative scoliosis cause more than just back pain. In fact, there are several signs or symptoms related to degenerative scoliosis. One of those is numbness or tingling or pain in the legs. A lot of times you'll see this down in someone's thigh. It could be the side or the front of the thigh, or it could be down the back of the legs. Another thing people with scoliosis get is something called intermittent claudication. And this is pain in the legs and feet when someone is standing or walking. A lot of times you'll see people that have increased pain with standing and walking, and a lot of times people have a difficulty walking when they have degenerative scoliosis. Along with that, a frequent symptom is a loss of balance. As people get degenerative scoliosis, their body gets out of balance, and the more severely out of balance this gets, that impacts someone's ability to be strong and stable. So as scoliosis progresses, people have less balance, and they also have an increased risk of falls, creating further injuries. Alteration in posture is another common sign. What typically happens with degenerative scoliosis, people will start to see their overall body shifting to one side, then they start to tilt back. And then when you look at it from the side, you'll see they start to lean or hunch forward. So as scoliosis develops, overall posture and balance and alignment progresses, and people notice their body appears out of a line, and they start to lean or shift to the side and then hunch forward. Another thing that's important to understand, as these curves progress and they get more and more severe, they get more challenging and more difficult to treat with conservative methods like bracing and scoliosis-specific exercise. Also, as someone ages and their curves tend to progress with age, they have an increased risk of complications with surgery. So not only do they not respond as well to conservative treatments, the more severe they get with age, many times surgeons don't want to operate on them because the odds of the surgery being successful also decreases. So you want to treat these things as early as possible. And the third takeaway is there are successful non-surgical treatment options, and the earlier we can implement these, the better the long-term outcomes. So if you're an adult and you have pain from scoliosis and you're aware of it, you should seek out treatment right away. Because I understand it may not be something that's absolutely debilitating yet, but you want to attack it before it gets that. So the earlier we address these things, the better the potential outcome. Now, in adults that are younger and more flexible, a lot of times we can even reduce the size of the curve. But as you get older, the overall goals change. The goals for adults with degenerative scoliosis are 1, to decrease or eliminate pain. 2, to stop or slow the progression of the curve. And 3, to improve activities of daily living or quality of life. What that means is we want to enhance your ability to do the things that you already able to do. Now there's 2 different treatments that we know are very effective for degenerative scoliosis. One of those is scoliosis-specific physiotherapy or physical therapy. Now that's different than traditional physical therapy in the fact that with scoliosis-specific physical therapy, we're going to 1, teach you how to put your body in the correct position or alignment. And then 2, we're going to start to strengthen and stabilize you while you're holding your body in the correct position. And the third thing we're going to do is we're going to incorporate that into your activities of daily living. Meaning we're going to teach you how to hold your body in proper position or alignment while you're doing the things you already do. It could be while doing things around the house, while cooking or cleaning, but we're going to incorporate that rehab into your active lifestyle, and that's going to make the rehab more sustainable long term. The other treatment option is a custom brace. Now this is different than a brace you buy on Amazon or one of the Velcro braces maybe your healthcare provider prescribes you, but it's custom made for you. You see, with degenerative scoliosis, you're literally in a tug of war with gravity, and you tend to lose that war little by little over time. Gravity's pushing down and your spine is collapsing and breaking down and degenerating and decaying under the weight of gravity. So what a custom brace does, it holds your spine in proper alignment and it stabilizes you and it keeps your body from collapsing under the weight of gravity. These are typically worn 4 to 8 hours a day, and they're highly effective at stopping or dramatically slowing the rate of curve progression, and they're very effective at eliminating or decreasing the amount of pain someone gets from the scoliosis. Scoliosis-specific exercise and common bracing can reduce the size of the curve in some cases, usually when someone's younger, more flexible, but many times we can improve the overall spinal balance or alignment, which is how much is shifted off to the side, which another way of putting that is we can frequently improve someone's overall posture, and we're very effective at reducing pain and stopping or slowing curve progression. So if you're watching this and you have pain from scoliosis, or you know you have a degenerative scoliosis, click on the link below. Request a free discovery call. That's going to give you a chance to talk to me one-on-one about your scoliosis. We'll go over the severity of your scoliosis, how likely it is to progress if you don't do anything about it, and what treatment options you're a candidate for. Now, after watching this video, you have a better understanding of what degenerative scoliosis is. But for more in-depth learning about the best and most effective treatments for degenerative scoliosis, click on our next video, and I'll see you there.